gentlemen, welcome in the assessments in Healthcare Service in Pandemias Institute. What does a healthcare service do? As your assessor, I am responsible for designing and delivering learning and development sessions to help improve both knowledge and skills for staff in social care setting. Second, as your assessors, I could either work for a health and social care employer and deliver staff training sessions within the organization. Or I could work in an independent training provider that delivers staff training to various health and social care employers. You can ask me now, what are the rules and responsibilities of a healthcare service assessor? First, conducting assessments to ensure all staff are equipped with the necessary skills and knowledge for the role. Second, creating and delivering staff training sessions. Third, commissioning staff training with external organizations. Then fourth one, regularly reviewing and evaluating how effective training has been. Fifth, maintaining and updating staff training records. And another questions, what are the purpose of a healthcare service assessment? First, irregular assessments or the health checks are performed by hospital staff during hospital stay. Then, for some assessments, you need to answer questions. What are those? Others require you to do the task. The staff may also gather information from your family and careers and your GP during the assessment process. And assessments are often repeated throughout your stay to help the staff measure your progress. Then, be open and honest when answering assessment questions. Assessments help identify your care needs so you can work with hospital staff to get better. The assessment process is particularly valuable for older people who may decline more rapidly when they are admitted to the hospital. Then, these are the orientation, the documentation, and appointment in an assessment, particularly in a healthcare service assessment. Before providing healthcare services, assessors must complete standard training, understand their responsibilities. What are those? First, complete required training. Assessors must complete standard training, understand their responsibilities. You may participate in a national screening and assessment form or the NSAF and systems training. Another, the self-paced learning experiences. And last, induction training. Second, as an assessor, you must understand your responsibilities. You must understand and meet your responsibilities as an healthcare service assessor. Your contract and assessment manual sets out these responsibilities. And the third one is that set up access to the healthcare service assessor portal. As an assessor, you will use the healthcare service portal to first access referrals for assessment, then do the assessments Next, develop support plans, refer clients to the service, update client records, review support plans. Then, healthcare records, documentation, and management are kept and maintained. What are the purpose? The purpose of this policy is to first define the requirements for the documentation and management of healthcare records across public health organizations or the PHOs in the NSW public health system. Another is that ensure that high standards for documentation and management of healthcare records are maintained, consistent with common law, legislative order, ethical, and current best practice requirements. Then, the mandatory requirements. Documentation in healthcare records must provide an accurate description of its patient or clients, episodes of care or contract with healthcare personnel. The policy requires that the healthcare record is available for every patient or client to assist with assessment and treatment, continuity of care, clinical handover, patient safety, and clinical quality improvement, education, research, evaluation, medico-legal, funding, and statutory requirements. Then, healthcare record management practices must comply with this policy. We come now to the part of implementation. The chief executives are responsible for first, establishing mechanisms to ensure compliance with the requirements of this policy. Another is that ensuring healthcare personnel are advised that compliance with this policy is part of their patient or the client care responsibilities. The third one, ensuring line managers are advised that they are accountable. May pananagutan po sila for implementation of this policy. Then, ensuring implementation of a framework for auditing of healthcare records and reporting the results. Then, the fifth, ensuring healthcare records are audited and results reported with the PHO. And sixth one, facility or the service managers are responsible for ensuring the requirements of this policy are disseminated and implemented in their hospital or the department or the service. 7. Ensuring healthcare personnel with their facility or service have timely access to paper-based and electronic healthcare records. And lastly, monitoring compliance with this policy, including healthcare record, audit programs, and acting on the audit results. What are the healthcare personnel responsible for? They are responsible for maintaining their knowledge, documentation, and management of the healthcare records consistent with the requirements of this policy. And the last but not the least, ensuring they are aware of current information about the patient or client under their care, including where appropriate reviewing entries in the health record. As an assessor, you must know and aware of what is your role or your responsibilities in the assessment. What are the purpose of the assessment? And you must know how to explain the assessment orientation, documentation, and appointment.